Rep. Ingram, you have a question from Becky, just to ask you to talk about racism as a public health crisis.
Thank you for that. House Concurrent Resolution 31 moves that forward as a recognition as a public health crisis, simply because racism impacts absolutely everything we do, unfortunately, negatively. And it exacerbates all of the issues that were already there for a health crisis, because as you see, minorities, African Americans and other minorities are more susceptible to die from the coronavirus, and underlying conditions which also make them higher at risk are because of, unfortunately, racism, systemic, that disallows certain people to have the kind of medical care that they need and that they have access to. And a lot of people say, well, they can go to the hospital. Well, how about the clinic? The clinic gets closed. Those are things that are important. Education. So when you look at how it impacts us negatively, where you live, because you can't afford to live anywhere else. It used to be a time where if you would only see electric lines around where poor people live. The substation was right there. Those are the kinds of things that we have to look at. Only people who live near the manufacturing plant where there's all the soot and whatever, or people who couldn't afford to live anywhere else. So as a crisis, it says enough is enough. Let's take a look at that. That's what the resolution wants us to do, to take a look at how all of these bills that we pass impact African Americans and people of color, poor people, LGBT. I mean, we have to look at all of that when we're looking at this, to be fair to people in Ohio. So racism is an issue that, what we have right now is the consequences of a long time historical demeaning of a certain group of people simply because of the color of their skin.